Thank you.
Thank you so much. Yes. Station, and here is the question. Right. If you have read and understood, kindly please tell me what is your provisional diagnosis for this patient?
Okay, for this patient, my present diagnosis will be, first of all, pathology of chest, like cancer of the lungs.
Okay. Any other differentials you would consider?
I can also consider maybe bleeding from the esophagus, like because the patient is alcoholic, so I can consider mallory syndrome
And
or Urich syndrome or TB because of chronic involvement, then even
okay.
mesothelioma.
Yes. So can you please tell me if it's inflammatory cause? So can you please tell me what would be the pathogenesis of the disease condition?
If it is inflammatory cause, right?
Yes, if it's inflammatory cause.
Okay, so if it is inflammatory cause, the pathogenesis can be either TB,
Because
pulmonary
this
TB.
test X-ray reveals bilateral infiltrates, and sputum also
So that would be
shows
ARDS.
smear positive. Yes. So
You can
what?
have an ARDS.
Yes. So what would be the pathogenesis that you can tell me?
Okay, so if it's ARDS, the pathogenesis will be, we have three stages basically. So the first one, we have a stage of inflammation. So at this stage, there is a vasodilatation in the pulmonary vessel, and there is an increased permeability, so that there is a movement of fluid from the vessel into the tissues, causing the
Yes.
pulmonary edema and the reduction in irritated airspace, and also that will lead to reduction of the fertility perfusion ratio and the type 1 respiratory failure. Then, after this phase, of course, come to phase 1, there'll be migration of the neutrophil, macrophage, and all inflammatory cells also to the lungs. Then, after that, there'll be disruption of this and the increase of fibrosis deposition. Fibrosis in the lung. Then that will proceed until about 2 weeks or 3 weeks, when there'll be disruption and there'll be permanent deposition of fibrin in the lungs, which can lead to the long-term pulmonary fibrosis or
And
pneumosclerosis.
and
And if acute phase is not well managed, so it will lead to multi-organ failure and possibly death due to
we're not getting there. This is tuberculosis. Okay, if it's tuberculosis, so even in acute phase, there is one thing called granuloma. Can you please help me and define term granuloma?
okay, granuloma is they are larger cells, large cells, so that are found in a chronic inflammation, which are big, and in this case there will be also presence of aqueous necrosis.
Yes. Okay. So what are the other conditions in which you can find granuloma?
So in all chronic inflammations, for example, sarcoidosis,
Yes.
uh,
So maybe you can tell them like in infectious or an inflammatory, and then foreign body as well.
so infection, for example,
Yes.
sarcoidosis, in inflammatory condition, for example, Crohn's disease. Then also
Infection is tuberculosis and leprosy, syphilis, etc. And then inflammation, yes, sarcoidosis, Crohn's,
disease. So,
Wegener's granulomatosis. And then what about the foreign body?
oh, that one I can't remember that one.
No, just think simple. Surgeon, suture. Number 1, okay?
Yeah. Yeah, switch of course, gauge
Switch.
left in the body,
Yes. Yes.
or any respiratory member.
Yes. Good. Can you tell me what you understand by the term giant cells of Langerhans?
So these are modified special type of macrophages. So
Okay.
which modify and move into the tissue that help or that engulfs the foreign body.
All right. Can you please tell me how much time does a tuberculosis test takes or tuberculosis culture takes?
Oh, it takes about 3 to 4 weeks.
4 to 6 weeks.
Okay.
Can you please tell me what are the histological features that you will see in case of tuberculosis inflammation?
Okay. So the most important feature will be
Histologically, yes.
feature
Yes. If we are looking at this, what are we looking? Can you help me to describe this?
inflammation.
Yes. Can you explain in few words whatever you are looking at? Which stain is this?
Hello.
And yes, please. Yes, please. Which stain is it? And what are you looking at? Please. Can you explain? What are the tests that we can normally do for tuberculosis? Can anyone else continue
So,
if Dr. Sunday is having? Yes, Dr. Sunday. What are the tests that we can do for tuberculosis? It's the Zeal
Xylness
Nelson's.
instant.
Okay, and sputum examination, Montauk's test, PCR, and any other? Yes, please.
Ma'am, we did 3 tests on the sputum only, the culture, the
Yes.
microscopy, and the histology, and then we can go for the
Culture.
interferon, interferon test, gamma interferon test, chest
Yes.
X-ray as well, Montauk PSR.
Yes.
These are the basic tests we
So,
do.
what
And
should be the
is
treatment for tuberculosis?
PCR
Yes. Then, what
depending
should be the
depending
tuberculosis?
upon
Yes.
depending upon whether it is pulmonary or it is disseminated. So there are primary first line medication and second line medications. In first line we have this isoniazid, rifampicin, and uh, third one is it, ethambutol. And
Okay.
there are second line medication, and depending upon whether it is multi-drug resistant or not, we have to give the initial phase of therapy and the continuation phase of therapy.
Yes.
The initial phase of therapy will be for the 2 months, and the continuation phase will be for the 4 months. But in case of multi-drug resistant, we have to extend the period of both the initial phase as well as the continuous phase.
Good. Very good. Okay. Can you tell me what you understand by the Mycobacterium? Dr. Sunday is back. Yes.
okay, I talk
Yes.
to me.
All right, Dr.
So,
Ishfaq. Can you please tell?
hello.
Yes. Mycobacterium. Can you please define?
So, these are bacteria that cause tuberculosis, and there are different types. For example, we have a Mycobacterium tuberculosis, Mycobacterium avium, so which is an intracellular Mycobacterium and it is probably common in a disseminated type of a TB. And then we also have Mycobacterium bovis. So, and hello, should I
Yes.
continue?
Yes. 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 Yes, please.
Okay. So, so they have been diagnosed by mainly by the nursing training and with a PCR test to differentiate different type of TB, and also use of a mantle skin test.
All right. Okay. Can you help me to read this chest X-ray? Does not belong to the patient, but still. What do you see?
Okay, so on this chest X-ray, I can see different kind of focal infiltration of the lungs, and then mostly on the left side of the lung. So I can see on the apical side, I can see infiltration. with a caseous necrosis in between, like a cavitation in between.
Okay. Can you please tell me once you have collected a sputum sample from a patient, what would you do with that?
Okay, so first of all, I have to put it in a biohazard bag. So I have to label it according to UN category B, UN 3373. So the red bags, biohazard bag, and they have to transport it. So which a special form of transport with proper labeling to be a biohazard bag. Then I have to also inform the CDC about the possible infection and also initiate the contact tracing for the patient.
Okay. Can you tell me why tuberculosis is a public health concern?
Yeah, because TB, first of all, is common among those who have suffered from immunodeficiency and is an communicable disease. So, and because of this, it is better we do contact tracing, isolate the patient, and also inform the CDC because it can lead to epidemic or even pandemic if not controlled.
Okay. So if a person catches tuberculosis, what should you do? What should your advice be to that patient?
Okay,
To that
so for
person?
the patient, yeah, first of all, I will advise self-isolation, which is very compulsory. Then the use of a PPE like a mask, and also staying away from people, and also patient to stop working, especially if person works in a food factory or anywhere where it can disseminate the bacteria easily. Then also,
Yes.
I also advise contact tracing. So for the past maybe 4 weeks. So trace all the contacts, screen each contact for possible TB, and also advise them for the same thing.
Okay, good.
And also inform the CDC of the case.
Okay, yeah. Can you name one test for the rapid detection of Mycobacterium?
Okay, so mantle skin test is one rapid one. Then, but the most common one is sputum examination with a senescent stain. Then PCR is another test that's very good.
Okay. Can you tell me that what is the proteinaceous substance that is found systemically in tuberculosis?
Amyloid protein.
Yes, amyloid, AA amyloid. Okay, good. All right, good. It's needless to say that you have to brush up this topic again. Yeah.